Hi everyone. I asked you to be here today so that I could address some research that I've been doing on our inpatient unit, which is F66 Gynecology, Urology, Plastics, Ear, Nose, and Throat. I'll be referencing some material throughout this presentation, but I did a SWOT analysis on surgical site infections and the need to reduce them on our inpatient units. And some information that I found intriguing was that surgical site infections can increase patient recovery time, may delay in healing, um, create some poor outcomes for patients that can result in scarring and persistent pain, restrictive movement, and potentially even death. Surgical site infections place a burden on both the patient and the healthcare systems and could account for about 20% of all hospital wound infections. So what I found in our SWOT analysis was that we're a strong unit with good communication. We work together great as a team. We do have inpatient wound and skin nurses who are trained to be champions on the unit as a good resource to ask questions or to have a second set of eyes on wounds that the other nurses may be unsure of or unsure how to care for those wounds. Routine audits have shown that we present 100% with compliance in our hand hygiene. We're a magnet hospital, so not just the unit, but the whole hospital is magnet, and we were recently redesignated for the second time, meaning that we're magnet ×3, which is a great accomplishment. So we have a lot going well for us, and some of our weaknesses, though, that I found could be that we're a large teaching hospital with many physicians, residents, and nursing residents coming through, a large number of students. We're a very busy surgical unit with multiple admissions and discharges every day, so sometimes that takes away from our teaching and potentially sending patients home without adequate teaching about how to take care of their wounds. We do have, as I mentioned before, wound and skin resource nurses, and as a hospital, we have only about 4 that I'm aware of certified wound and skin nurses in the hospital for a hospital of 592 beds, as well as covering the clinic. So that could be considered one of our weaknesses, potentially not enough time to spend with each patient. Also, one weakness also that I've noted is that increasing patient protocols sometimes takes a little bit more buy-in from staff. Opportunities is that we can improve our patient outcomes, we can reduce surgical site infections, and we can improve our patient education. Some of the threats for this are loss of revenue due to patient readmissions and poor patient outcomes, as Medicare and Medicaid have changed how they reimburse hospitals and facilities based on these outcomes. So overall change is needed. And what I found was that while we already do a CHG treatment, bathing treatment with all patients, we need to do something a little bit more specific with our surgical sites. So continuing on with this, we'd like to develop a protocol for our surgical site care. And one of the things that in the hospital that we've already done is change the direction of how long surgical site dressings stay on, or post-op dressings, and timing those and what we do with the care of those. So what I would like to do is develop a task force or a team, including the major stakeholders, our CNS, our clinical nurse educator, our dietary staff, along with PT, OT, the nurses on the unit, the nursing assistants, our physician colleagues and resident colleagues, the nursing students, the nursing residents, and any of our other interdisciplinary team members, such as case management. They're many times involved with this because they're the ones sending patients home with additional care needed when they do develop a surgical site infection. In order to evaluate this program, I would like to do monthly meetings with the key stakeholders and work on goal setting and planning, develop education for our staff through computer-based training, which we already use here at the hospital and is found as very easy for the staff to look at those CBTs. Also do some education during our staff meetings and one-on-one if need be. We'd present some posters and have those up in the nursing or the staff break room, and then some mini flyers in areas where people typically spend a few moments each day in the locker room, in the bathrooms, to be able to view the information. Once all the education is in place, I would like to present all of our goals. And looking at the SWOT analysis, one of the first goals that I noticed during the SWOT analysis was the need to reduce surgical site infections. So looking at the data, I think that we could reasonably decrease surgical site infections by 10% within the first couple months, and a total reduction of surgical site infections in roughly 6 months. And to do this, we would evaluate and train only those physicians, residents, staff on F66 to begin with, have the orders in place, and would take out any of those patients who would be considered boarders or off-service patients to our unit. So general surgery patients that we typically aren't in those 4 specialty areas. We would take those numbers out. We would look at our data from the previous year and compare it service to service and also month to month to see where our number's at, and be able to give those updates to all of the key stakeholders and the staff at staff meetings and our monthly team meetings for this. I feel like 6 months is a good time to process and to figure out if what we're doing is working. We would continue during the monthly team meetings looking at our PDCA, so the Plan, Do, Check, Act, and evaluating that each month to see if we're online with our goals and to see what might need to be tweaked or what might need to be refined, or what's working well. And if things are working great, we'll leave them the way they are. And if they're not, we need to figure out what we need to do to move forward to bring it all in. Additionally, we would post this information after it's been presented at the staff meetings so that the staff know what they're doing and how they're doing, and getting that feedback, both positive and maybe a little bit negative, on what's working and what's not, and where we need to go to move forward. Before the end of the program, what I would like to do also is to disseminate a survey or a questionnaire about how they felt like the program went, how the protocol was put in place, if the education looked was enough, if they felt like there needed to be more, what needed to be changed, what could be added, what could be taken out, and then also, as far as being the team leader of this project, of getting some feedback of how they felt that I did throughout this whole process, and what I need to work on, and what went well and what didn't. What we're hoping to do is see a significant decrease in surgical site infections on F66, and after we gather all this information after roughly a 6-month period of taking it house-wide. If everything's working well and we're seeing the good numbers that we plan to see, I could see this going as a house-wide surgical services protocol, and we could go to other units and teach them the same thing that we did, and what worked and tips and tricks and what didn't work, and what we needed to refine. As a hospital and as a whole, I think this would be something that would be a cost-saving protocol, and I think it would increase patient satisfaction and patient outcomes, which is really our main goal in patient care. You know, we want our patients to leave happy and healthy and be able to continue on with their lives after they leave the hospital and not have their surgery that they thought was going to be a 2 to 4 month recovery extend into much longer or a lifelong issue. So with that, I'm going to close and just let you know that if you have any questions, you can contact me through my email or on the unit. I will have information sheets out there, and we'll be setting up our first meeting in the next week or two so that we can get started on this project. I hope you find it as interesting as I have, and let's see what we can do with this. I'm really excited to get started. So thank you. If anyone has any questions, I'd be happy to take them at this point. Thank you.